Beverly Riley, Beverly, Riley, Riley.
Okay. Now, can you tell us your position?
I'm a massage therapist here in Omaha.
Okay, thanks. So my first question is, what do you know about energy healing?
Energy healing is, you get introduced to that in massage therapy as using the energy throughout the body to heal the person you're working on, heal their complaints of soreness, tightness, aches, pains, to help them recover from an injury or an illness, for them to feel better.
Okay. Have you had the practice performed on you before?
Yes.
Can you elaborate on that?
I have had different types of healing energy work done on me. I've had healing touch worked on me, Reiki, bars, body talk are just a few of the ones I've had.
Okay. Have you performed the practice on other people?
Yes, to an extent. I've taken Healing Touch Course 1, so I'm familiar with some of the techniques, and I practice those on some of my clients. And then there's other just general energy work, flowing the energy throughout the body that I've learned with lymphatic drainage therapy that I do.
Okay. How is energy healing involved in massage therapy?
Massage therapy started, centuries ago, literally back when they were looking through the history of China. They had pictures on walls that depicted reflexology being worked on different people. So massage has been around for years, and it has evolved through time to becoming more medically recognized. And massage led more into energy work, but I see more of it evolving through the nursing community, because Healing Touch began through the nursing community using biofield energy techniques to work the whole body through their energy fields around the body.
Okay. So how is energy healing involved in local hospitals?
In some of the local hospitals, they use healing energy to work with clients on a different level than massage. Massage, we're working with the tissue, soft tissue manipulation, stretching, that sort of thing to ease the pain and increase flexibility and mobility. Healing Touch has a different aspect of working on a more gentle level for younger children, infants, to the elderly that are more frail and cannot tolerate the pressure that massage uses. And Healing Touch does such an amazing job with working with their mind, body, spirit connection, as well as simple things of decreasing heart rate, decreasing blood pressure, increasing immune capabilities, to just allow reduction in anxiety.
I could use that, reduction of blood pressure. I mean, I struggle with that sometimes. What's your involvement with Jane?
Jane and I have been working together since January, and we work in the same facility, but also we do some co-treats, as we use the term. She'll work on one of the clients and I work on the other in the same room.
Okay. So what are some results of energy healing?
The energy healing, the results I see are calmness when somebody's upset, relaxation. They seem to be more at peace with their procedures that are going on, or things that they're having trouble dealing with or working through. There's an ease, a clarity of how they feel. When I have had energy work done on me, I find that I feel more calm and I can address things that make me more anxious a little easier.
Okay. I think we went over this, but I'm just going to ask it again just in case. So how old is the practice?
I'm not sure how old it is, but I have read and learned through other Healing Touch practitioners that Healing Touch was actually first discovered, the bioelectrical aspect of it was first discovered by Albert Einstein.
Interesting. And I was reading some of it. dates back to ancient China?
Some does, yes.
Some sort of practice?
Yes.
Are there different variations of energy healing?
There are different variations in the aspect of techniques, and that's how I've learned to understand it mostly, is you'll have somebody that does healing touch, another person does Reiki, another person does body talk, harmonium, and they're all forms of healing energy, but they're different techniques that work in different ways.
So you focus on healing touch specifically?
I focus on the massage aspect to alleviate pain with soft tissue movement, stretching, that sort of techniques. And then I have also done some healing touch techniques to allow for calmness and relaxation as well.
But no Reiki or any other
No.
variations? Okay.
No.
So what type of patients are these used on in hospitals?
In some hospitals, you can see the patients getting the healing touch before or after a procedure, when they're working on their recovery and they need to work on anxiety, pain relief, just to overall enhance the healing process.
Stress relief too?
Stress relief as well. When you're in a hospital, for you, your loved one, whoever it is, it's very stressful. You have procedures going on that you're not familiar with. You don't know the outcome of it's going to be. You have times that you have to be there by yourself because of the COVID issues that we've had, or you are getting information that you're not sure how to process. So all of those things combined, you just feel very stressful, heightened anxiety, because you don't know what to expect for your loved one.
Okay. So when they do the healing touch and massage therapy in hospitals, is there a specific area in the facility they go to, or do you actually go to their rooms?
Some hospitals go to the patient. Like I know some of my friends that have done massage in the hospitals, they went to their bedside right before the surgery. Others might have a room, and that might be for the employees to go and have a stress management session. And then others go straight to the room for the patient.
Okay.
That's the nice thing with healing touch and massage, because you can do it bedside or you can do it in a treatment room.
Yes, makes sense. Do you need some sort of certificate or degree to become an energy healer, or do you have to train in it?
In Nebraska, you have to be licensed to touch, as in massage therapist or a nurse, some sort of degree that allows you to touch another person and work on them. Then your different aspects of healing energy take different amounts of time. Healing touch, I believe you take 4 different courses, and then you have to train under somebody for a while, and then you have to practice so many hours. The others are certificates of so many hours of learning and practice.
Is that given out by a government or a certain organization?
Both. So for like massage therapy, I am a licensed massage therapist here in town. I've had 1,000 hours through a accredited school, but the techniques I've learned for healing energy and lymphatic work is through a certification from another training company.
What was the training company called?
The lymphatic work I do is through the Chickley Institute, and I have taken 4 of their courses, and they're 4 days apiece. So I've had upwards of 100 hours of training or more.
Okay, and the massage therapy that went through?
The one I went to is Universal College of Healing Arts, and it's a 1,000-hour program here in Nebraska.
Okay. So in massage therapy, I'm not exactly sure how to do this, but do they offer energy healing as a different service, like a different price range? Or?
It's actually, with massage therapy, you learn your basic techniques of Swedish massage, and some teach deep tissue massage. But then once you graduate, then you go on for continued education, and that's where you can go into spa techniques, medical massage, healing touch, other forms of energy work. But most of the energy work is, you're taught that by going to continued education courses after you become a licensed nurse, licensed massage therapist.
Yeah, so let's say somebody wants to open up a massage therapy business, small business, could they offer energy healing as a different service? Or,
Yes.
Or both, combine them, or?
Yes, it's often used by the same person, or they have a partner in their office that does it. One of the places I have worked, we had 5 massage therapists and 2 energy workers. And one of them was a massage therapist also. So she did both. And with my training now, I've only went through Healing Touch Level 1. So I can do some of the healing energy work while I'm doing massage, but I cannot offer it as a separate service because I don't have enough training.
So you would have to be associated with somebody else to do that?
Correct.
So like Jane?
Jane would be a blessing to have in an office.
Okay. So that's a common thing?
Very common. Very common.
Massage, therapy, and energy healing. Okay.
Yes.
So how is energy healing used in combination with other more traditional medicine practices?
It's actually becoming more and more accepted in the medical community because there are studies that show the healing has become, how do I say, the healing is quicker. It is a better healing when people have the healing touch throughout their healing process in the hospital. You find that the anxiety is lowered. You find their heart rate after surgeries comes back down, their blood pressure comes back down, and it's used quite frequently in pain management because there are techniques that you can do through the healing touch to decrease your pain.
Okay.
And with the healing touch being founded in nursing, it gives it that extra medical backing, so to speak, that other professionals see that as a valid modality to use for their patients.
Okay, so you think in the future, let's say 10, 20, 50 years, it could be used more often?
I think so. And I think it's because we were becoming more advanced in how we present our information. They're looking to other forms of pain management other than just medications. One of the things that we've seen in the last several years is the increased use of opioids for pain management and the unfortunate problems that come with it with addiction. And since they've stepped back from using opioids, they now turn to alternative reasons, methods to control pain. And energy work, massage therapy, acupuncture, dry needling, these are all things that people are getting to be well accepted to do for pain management.
Yeah, probably a healthier way of dealing with pain.
Much healthier, less addictive, and it's healing the whole body because people that I work on come in with an injury in one area and then you find that you work the opposite area and they feel much better as well. So they're coming complaining of shoulder pain, but then you work on their hip and their hip is part of the issue.
Yeah, that goes for a lot of knee issues with people. It's either
Correct.
hip or knee or ankle.
Exactly.
Yeah.
And it's the compensation that you do when you move throughout the day that causes that secondary injury that a lot of times is managed by muscle manipulation, like massage.
Aren't a lot of nerves and pressure points kind of connected throughout the body? So like, let's say you feel like you step on a rock on your foot and you can feel it on your shoulder.
Exactly. And the training I've had, it shows, studies have shown that people work in diagonals. So when you hurt your left shoulder, you're actually connected at your right hip. So there's a diagonal pattern of pain. So you work that whole pattern. Nobody walks in a straight motion. You swing your arms opposite, you swing your legs opposite. So a lot of times your injury is opposite.
Okay. Any final thoughts or comments?
I'm glad to be able to work with Jane and learn from her about the healing touch techniques that she does, because I'm very fascinated that the body responds to it so well, and it responds well from all ages, from infants to elderly, and the peacefulness and the decrease in pain and decrease in stress and anxiety that they have with healing touch. It's very wonderful to see.
And in Omaha, the community, this is becoming more of a common practice there?
Yes, it's actually becoming more and more well known, and there are more people becoming more acceptable to it and enjoy it and actually use it for their method of monthly self-care.
Okay, that's all I have for you.